Have you ever wondered what can you do as a healthcare provider to address the unique challenges that Black women face in healthcare? Well, stick around because in this video, we're diving into the 5 challenges that might reshape your approach to Black healthcare. And you're really going to want to talk about challenge number 3, a critical issue that demands immediate attention: maternal mortality amongst Black women. I'll unravel the intricacies of this challenge later in the video, so stay tuned. Hey there, I am Tomesha, the founder of Enhance Black Women's Health, and I aim to empower you with the knowledge and tools to deliver equitable and effective care to Black women. But before we start, please drop a comment below letting me know your biggest challenge in providing health care to Black women. Let's work together to find solutions. And while at it, remember to join my free EBWH community newsletter. It's your weekly go-to source for insights and recommendations tailored for healthcare providers that are committed to equitable care for Black women. The link is in the description box below. Now, let's dive into those challenges I've mentioned earlier. Challenge number 1, body mass index. Body mass index, or BMI, is a one-size-fits-all metric for health assessment that causes harm mainly when applied to diverse populations. Black women in particular often face the consequences of a system that fails to recognize their unique body compositions. That's why overcoming this challenge really requires ditching this one-size-fits-all approach, and instead of BMI, healthcare providers must consider alternative health metrics, such as engagement and health-promoting behaviors. By doing so, we can stop oversimplifying the complexities of health and put more emphasis on overall health. Challenge 2, autoimmune diseases. As we know, Black women are disproportionately affected by autoimmune diseases. Despite this knowledge, Black women often go undiagnosed or misdiagnosed due to biases within our healthcare system. Therefore, healthcare providers must look beyond stereotypes. When performing examinations, providers must ensure that they are thorough and unbiased. This can help providers avoid inaccurately attributing symptoms solely to a person's weight and ensure that they treat the client, not the symptom. Challenge 3, maternal mortality. As I hinted at the beginning of this video, the rising rates of maternal mortality among Black women in the United States highlights a health challenge that demands our urgent attention. In comparison to their white counterparts, Black women are 3 times more likely to die from pregnancy-related complications. And systemic biases within our healthcare system play a significant role in the alarming rates of maternal mortality among Black women. These biases manifest in various forms, from racial disparities in access to healthcare to implicit biases that affect the way that healthcare providers interact with Black women. Therefore, addressing systemic biases requires a multifaceted approach that includes cultural competency training, mitigation of implicit biases, community advocacy, and policy changes. By recognizing and actively combating systemic biases, we can pave the way for a healthcare system that provides equitable care to Black women during pregnancy and childbirth. Challenge 4, mental health stigma. The stigma surrounding mental health persists, and Black women often bear the brunt of both racial and gender biases. Cultural nuances coupled with systemic challenges create an environment where mental health concerns are downplayed or even ignored. Through cultivating cultural competence, providers can foster open dialogues about mental health. And we cannot assume that our clients will take this action without help. Instead, we need to create a safe space for discussion and support. Thus, we can pave the way for more inclusive and effective mental health support for our clients. Challenge 5, access to quality healthcare. Despite strides in healthcare accessibility, disparities persist, affecting Black women's access to quality care. Everything from economic factors to geographic location can create barriers that hinder timely and effective interventions. As healthcare providers, this presents us with the opportunity to break down barriers. By advocating for policies that address economic factors, geographic disparities, and even institutional biases affecting access, we can ensure quality access to care. To sum it up, we've covered 5 challenges Black women face in healthcare: body mass index, autoimmune diseases, maternal mortality, mental health stigma, and access to quality healthcare. Despite these challenges, there are solutions that we can implement that will reshape our approach to providing equitable care to Black women. Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.